Good evening, I welcome you all to the webinar organized by Karnataka State Physiotherapy Federation. Today's topic, the basic of matrix physiotherapy. We have with us our very good friend VARUN C.NAIK, who's assistant professor with KLE College of Physiotherapy, Belagavi. He would be the speaker. We welcome you, sir.
Thank you, sir. Thank you.
We have our moderator and a good friend, Dr. Sriraghunath, sir, who's assistant professor with RV College of Physiotherapy. We welcome you, sir.
Oh, thank you. Thank you, Sai Mahendra, sir.
You told me. I've already spoken to her. I've spoken to her.
Thank you. Today all with us. Today we all have a guest with us who is Dr. Madhudan, sir, who has been elected as a vice president for Karnataka State Physiotherapy Federation. So we welcome, sir. Can you please unmute, sir? Madhudan, sir.
Okay. Is it audible?
Yeah, please. We welcome you, sir, and we welcome you, sir, and I would like you to address the gathering for today's webinar.
KSPF members and special dignitaries today in the form of Dr. VARUN and Sriraghunath, who is going to deliver a wonderful webinar series. Welcome you.
Thank you.
Special knowledge to all the KSPF participants, and as we have taken a special responsibility of taking further vision and further thoughts from our our colleagues, we have to take our versions in a better format so that we can deliver better objectives of physiotherapists, so that we can derive better knowledge, and also we can update more knowledge. And also, as a Karnataka State Physiotherapy Federation, we should be integrated so that knowledge should be spreading. And there is one ancient ukti called Nahi Gnanena Sadrusham Dhruvam that says updating knowledge never, less. Always you should keep updating your knowledge. Okay, nothing beyond the knowledge. It's an ancient format. And let's take this format and continue educational programs through webinars and seminars. And right now we can conduct only webinars because of COVID scenario. And I hope we'll come with seminars very shortly. And I welcome Mr. VARUN, Dr. VARUN, and also Dr. Sriraghunath for a wonderful further 45 minutes to 1 hour program. And also, thank my all Karnataka State Physiotherapy fellows so that they have all elected new members. Thanks once again for you all. Thank you. Thank you, Mahendra.
Thank you so much, Dr. Madhusudan, sir, for your good wishes and kind words. I hand over this program to Sriraghunath, sir. Can you please take it over, sir? Thank you so much.
Thank you, Dr. Sai Mahendra, sir. Good evening, one and all, and who have logged in for this webinar through various platforms, Zoom, Facebook Live, YouTube. I should say it's indeed a great initiative by KSPF to organize and host this kind of learning module and knowledge sharing platform. I would like to specially appreciate and thank the team KSPF, specifically Dr. Ayappan, Dr. Sai Mahendra, who is the organizing chairman of this webinar, Dr. Vinod Babu, executive committee member of KSPF. Furthermore, I would like to congratulate the new team, which includes Dr. Santosh Jidimani for being elected as the president of KSPF, Dr. Madhusudan KN for being elected as vice president of KSPF, Dr. Amit Usur for being elected as joint secretary, Dr. Adarsh for being elected as executive member, and my great friends Dr. Vinod Kumar Kesi and Dr. Mallikarjun for being elected as executive committee members, and finally Dr. Nirnay Gowda for being nominated as a chairperson for Anti-Quackery Cell Karnataka. Congratulations to the new team, and For today's webinar talk, the topic is today's talk is on basics of matrix rhythm therapy. The speaker for today's session is Dr. VARUN NAIK. Dr. VARUN NAIK completed his bachelor's and master's degree in physiotherapy from KLE Institute of Physiotherapy, Belagavi, Karnataka. He's a certified fourth matrix rhythm therapy instructor from Dr. Randoll Institute, Munich, Germany. Dr. VARUN has held various positions, like he was the HOD of Vijaya Orthopedic and Trauma Center. He has worked as a physiotherapist in Niramai Rehab, Sholapur. He has worked as a lecturer, and presently he's working as assistant professor in KLE Institute of Physiotherapy, Belagavi. Dr. VARUN NAIK has served as a sports physiotherapist for SISA Football Academy for Mohan Bagan football tournament, All India Women's Hockey Tournament, and non-stop speed skating relay marathon. These are the few of the things which Dr. VARUN NAIK has been associated with, and Dr. VARUN NAIK has been conferred with various awards. To mention a few of them, he has made a paper presentation with the International Symposium on Matrix Rhythm Therapy. He has secured a prize in paper presentation in 54th Annual IAP Conference. He had made a paper presentation on International Physiotherapy Conference, AquaCon 2017. The best thing among the whole lot is he's been recognized as a best teacher of student choice, which is very rare. Best teacher of student choice, 2016, organized by KLE University Institute of Physiotherapy. Along with this, Dr. VARUN has been a resource person for various conferences and workshops, and he has about 7 national and international publication with his name. This is a small introduction of Dr. VARUN NAIK, and furthermore, I request all the participants to mute their microphones, and we will be taking your questions, and it will be taken at the end of the session. Over to you, Dr. VARUN NAIK.
Thank you, sir. Thank you for the warm introduction. And I would like to thank the Karnataka State Physiotherapy Federation for giving me this opportunity to speak on the basics of matrix rhythm therapy. I'll be sharing my screen. Yes. So is the screen shared?
Yes, it is visible. It is shared. It is good.
Okay. Good evening, my colleagues. Today we are starting with a new concept by name the basics of matrix rhythm therapy. Now, when I say a new concept, the two things that I request all the attendees of this webinar is to have a paper and a pen to write down the things that I ask you to write. One. Second thing is, I request all of you to have a clean slate mind. I don't want what you have learned before to get jumbled up that I will be speaking in the basics of matrix rhythm therapy. Since it's a newer concept, there are various myths associated with matrix rhythm therapy. I just want to clarify and just to want to give an overview about this entire concept. So basically today we all are here for this webinar because of this one person by name Dr. Ulrich Randoll, sir. Sir, we all know he is the developer and inventor of matrix rhythm therapy, who has been working with matrix since 1990s and has treated several conditions using this one device. Brief introduction of him. Sir has graduated from the University of Frankfurt in the year 1991, and after having finished his studies, he worked as a medical doctor at the University of Erlangen, Nuremberg. Basically, he had his own shortcomings where his cases were complaining of pain, were complaining of stiffness, and because of which he started to develop and interest, how can he serve his cases in a better way where they can have reduced pain as well as have a better range of motion. So as we start with the entire concept, I want to show you some of my cases which I have worked in my center using matrix rhythm therapy. The first case is about frozen shoulder. Frozen shoulder, we all know it is the bread and butter for physiotherapists. Unless and until we cannot treat a frozen shoulder very well, maybe we need to polish our skills. So the first case is frozen shoulder. In the first video, you can see the range of abduction and the range of flexion. This is immediately after treatment. We can very well see there is a huge improvement in the range of this subject. Now, as a physiotherapy point of view, we all struggle in treating frozen shoulders to achieve range. And even if we achieve range, we take a lot of duration in terms of days, as well as there is satisfactory pain relief. But if you see this simple case, I have just blurred his face so that I should not reveal his identity. But if I show his face to all of you all, then in the before video, we all understand, we can see the pain which he will have during the movement, and after treatment there is no glimpses which is seen on his face. So in this 1 hour of therapy, we could see there is a major change in his range of motion of abduction and flexion. The second case is knee stiffness. We, as a physiotherapist, we all try to see knee stiffness cases in our clinical scenarios. This one is just after a ACL reconstruction. This is the available range. And after range is after 3 sessions of matrix rhythm therapy of 60 minutes each. We could see a near normal knee range of motion. The next case is elbow stiffness. Elbow stiffness is a difficult case for each and every physio, whether it may be exercise or whether it may be mobilization, and the pain associated with physiotherapy management is tremendous. But with matrix rhythm therapy, we have achieved this range. The before and the after is after 2 sessions of matrix rhythm therapy. The next case is a paraplegic. We all work with paraplegics where we want to improve the quality of life by making a case pretty much independent. But there are shortcomings because of the postural alignment or XYZ reasons. The alignment of the human body is not such that the center of gravity will always be falling within the base of support. Hence, standing is a very difficult task in a paraplegia. But in this case, in one video, we can see how the subject is entering the center. He literally requires 2 assistants. And we have given him almost 10 sessions of matrix rhythm therapy, which has aided in his rehabilitation process. It's not only matrix that we have worked upon. We have added matrix as well as the rehabilitation in him so that we can make him independent. The next case is of trismus. Trismus, I don't think all the physiotherapists or all the musculoskeletal physiotherapists work in this condition, because it's a challenging condition, mobilizing a TM joint, and that also we have to be very meticulous and precise in treating. But with matrix rhythm therapy, these are the pre and post images that we can easily see the change what we have got. In the first case, the gentleman was treated with 3 sessions of matrix of 60 minutes each, and the young female is also treated with 3 sessions of matrix rhythm therapy of 60 minutes each. The range is evident. Now we all fail to achieve range. Maybe pain relief, yes, with our electrotherapeutic modalities we can very well achieve the pain relief component, but achieving the range is probably little difficult. But with matrix it was a piece of cake. Now this particular case, a chronic lumbago young gentleman who complains of low back pain, and was, I think he used to complain of pain since 9 months, and he had undergone various physiotherapy treatments. He has consulted orthopedics, everything, but nothing was helping. But after our initial assessment, we understood that the hamstrings are pretty tight, and that may be one of the reasons for his chronic low back pain. The importance of this picture is we can very well see the timing that I have recorded. The pre-treatment was done at 5:35 p.m. and post-treatment image is at 6:30 p.m. So just within 1 hour, the change is evident, and these are photographic evidences. We cannot tamper any of these images, and we can see the range what we have achieved post-treatment of just 1 hour. Next important case, probably again, if such cases come into our centers, we may probably advise them for varicose vein stockings, and we may deal with some physiotherapeutic equipments. But with matrix rhythm therapy, you can see the skin changes which are associated, the pre and post. It is very well evident that there is improved microcirculation, and hence there is improvement in the symptoms of this particular case. This one is a non-healing ulcer. Now this boy is a 15-year-old who was diagnosed with thalassemia, and he was having this ulcer since 3 months, and it was not healing. And the father just brought him in our center, and he asked whether something can be done. Now, 2 important things in this particular case is, one is the boy is diagnosed with thalassemia, so oxygen deficiency will be there. Second one is it is at the peripheral level, so where there is compromised circulation. But with the help of matrix rhythm therapy, we have completely closed the ulcer. There was no dressing done. There was no secondary treatment given. It was purely matrix rhythm therapy. Now, with all these cases, it is evident that the scope of physiotherapy practice increases drastically, where we keep seeing the conventional cases of low back pain, tennis elbow, stroke, and all these cases. These are newer advancement where each and every physiotherapist can inculcate in his clinical practice. Next one is Bell's palsy. Yes, definitely with electrical stimulation, laser, Bell's palsy improves, but this case has improved with 14 days. That is just 2 sessions of matrix rhythm therapy. And the cause was again a cold exposure. So with these brief cases, I am sure that you may be thinking, how is it possible? Or the cases are very much challenging. But right now, the next question that comes is, why does matrix rhythm therapy work? Or how does matrix rhythm therapy work? So for that, we all keep saying in our uh, clinical practice to our cases or to our friends that physio adds life to the years. So when we say adding life, what do we mean by life? Life for us is nothing but the difference between human being and its dead body. It's as simple. For us as a medical professional, we need not go into the psychological or physiological aspects. We just need to concentrate on uh, the difference between a human being and a dead body. So we will be dealing with human beings. We don't deal with any dead bodies. So then what sets the rhythm for this life? So the rhythm is set by the cells. So all the cells, when they are alive, they oscillate. This is the basic concept. This concept is going through many years. We are unable to understand. And these oscillations have an identical frequency and amplitude. And the cells of our body are floating in an extracellular matrix. Now, imagine a body which does not have a good extracellular matrix, or a cell which is not functioning normally. Definitely, it will lead to a disease process. So, logistics of extracellular matrix estimates process of healing. If you consider any of our physiotherapeutic equipments, what we try to do, we never try to treat any of the diseases. We only try to create a conducive environment where the body will try to heal itself. None of us are treaters. We are only healers. We try to form a very good environment so that the body heals from within. So then, what are these actual rhythms? The rhythms are nothing but they are the pulses estimate of our life. Now a muscle contracts, there is a rhythm. The heart beats, there is a rhythm. We breathe, there is a rhythm. So each and every living processes are coherent. Now what do we understand by coherence? Coherence means anything that is placed in a particular way so that it does not disturb the environment. They all work together in harmony. So until and unless the body is working in harmony with each and every systems that are present in our body, we say that the body is healthy. Any disruption will lead to a disease process. And to maintain this, the muscle cells work as coupled oscillators. The coupled oscillators means in biomechanics, coupled oscillators is nothing but any material which possess the quality of electromagnetic magnetism. Now, electro, that is electrical charge, as well as magnetism, where we have magnetic energy. So muscles definitely working as coupled oscillators. Now, we have to speak about muscle and coupled oscillators. Now, muscle electrical activity is through the action potential. It's an electrical charge. And the magnetic field is created by the positive and the negative ions which are present intracellular as well as extracellular. So whenever there is a stable environment between these two components, the body is healthy. Whenever these two components are unstable, it leads to a disease process. So there are so many rhythms in our body. The basic rhythm is our brain rhythm, which is beta, alpha, theta, delta, where we tend to work with the alpha rhythm. Now, why alpha rhythm is important for us? If we consider stress, In the stress, the alpha rhythm is altered. It does not come into the range of 7 to 13. So whenever there is disruption in this particular range, it only disrupts the entire cyclic process of our human body. Hence, it is very important for us to maintain our entire rhythms in alpha. Now, without rhythm, there is no life. This was told by Albert Einstein. So there are basically harmonic organs and organ stresses. Now, in harmonic organs, there is brain rhythm, that is the alpha, beta, theta, and delta. Which in this, the alpha rhythm is most important, which has a frequency of 8 to 12 hertz. Next one is heart rhythm. When we say heart rhythm, we always say that the heart beats at an average of 72 beats per minute. So this 72 has set a rhythm in our heart so that it has to work in this particular way. If it is less than 60, it is abnormal. If it is more than 100, then also it is abnormal. So in only the window bracket is very much important. So there is a rhythm. Then there is muscle quivering. Now this muscle quivering, we have to understand it is different from tremors. Now, if you place your hand in front and you will see that your hands are shaking. A young person, if he places his hand in front and it's not supported, and you'll see there is a slight movement in his hand, it is not actually tremors, it is the muscle quivering. This is a most important aspect. Muscle quivering, how do we differentiate a tremor from muscle quivering? Tremors have a frequency which is less than 6 hertz. Muscle quivering has a frequency which is between 8 to 12 hertz. So until and unless we cannot differentiate this, we cannot understand whether it is normal or whether it is abnormal. And muscle quivering is a normal process. It's not an abnormal process. And it is between 8 to 12 hertz. Next one is there is a microcirculation rhythm. Then there are so many other rhythms like breathing rhythm, ovulation cycle rhythm, sleeping awake rhythm, hormone rhythm, cell oscillations, and molecular oscillations. Now, these are all normal rhythms which are present in our human body. And these entire rhythm is set up by mechanical, chemical, galvanic, electromagnetic, infectious, acoustic, toxic, allergic, nerval, and emotional. Now in this, some are normal and some are abnormal. Whenever the abnormal organ stress takes over, there is disruption in the harmonic organ, and that leads to a disease process. So basically, we need to understand now the physiology of muscle. Now, since our body is made more than 85% of muscle, so basically we physiotherapists of any stream, we need to understand muscle because we are basically treating muscle. It may be of any branch, but basically we are targeting muscle. And hence, what I believe is we should be called as myologists rather than physiotherapists, because myologist makes more sense for us because we are working on the muscles. So without muscle, imagine a body without muscle, there won't be any rhythm, there won't be any circulation, there won't be any process, there won't be any function, there won't be a movement, and there won't be a processor. So physiotherapy, we always say you have to move, you have to do your exercises. A sedentary lifestyle is bad. So when we say move, the body doesn't move by itself, the muscles work. It's like rightly said that the bone always follows the muscle. It's only the muscle which moves the bone. Bone cannot move by itself. So whatever we keep seeing a deformity or any disruption, it's only because there is an muscle imbalance. So in our assessment, we have to understand what is the muscular imbalance produced in the disease process. So basically, coming back to muscle quivering, what is muscle quivering? It is nothing but the milking process. The use of milking process is it centralizes liquid to avoid the cell death. and that is caused by physiological lymph drainage. Now, as physiotherapy point of view, we do not study lymphatic system very well. We tend to keep it as an optional for a physiology examination. But for our understanding, lymphatic system is the most important system, where we tend to drain the entire metabolic waste products, try to create a healthy environment so that the body can function normally. So in extreme conditions where we are unable to maintain a muscle quivering, there is orthostatic collapse, there is fever, there is temperature. So there is an absence of rescue frequency. Now, for example, if a person is having fever and he's shivering, what he's trying to do, it's not an abnormal process of shivering is not considered abnormal. It is the body is trying to raise the core temperature. So it can do only when the muscles are contracting and relaxing. So that is an important process. And orthostatic collapse, we all know that there is falling of BP and all when the person is lying for a long duration. So but why is it so important? It is only important because the muscles keep contracting. So whenever there is absence of contraction, it will lead to collapse in the circulatory system, and collapse in the circulatory system collapses the entire body. So I don't know, or it's a simple question to all the attendees. We have studied electrotherapy, we have studied ultrasound, IFT, TENS, all the equipments. The first question that I want to pose to all the attendees who can introspect yourself is, how does ultrasound act on a human cell? I'm not talking about a specific condition. I'm talking about how does the ultrasound treatment act on a single cell of human. So with that question, we move on to the micro world of muscle contractions. So basically, when the muscle contracts, there is rigor mortis. That is, there are small areas of acidosis which are reactive. There is accumulation of lactic acid, there is swelling, there is so many things which are associated with this particular aspect, and this leads to fatigue. And this is basically because of there is swelling, there is bradykinin or serotonin, and then there is histamine, then which leads to fibrosis, and finally it leads to necrosis. So we have to identify all this in a pathological state. Where is the problem in the muscle? Whether it is in the belly, or whether it is only in the specific areas. So once we locate this particular area, it is easier for us to treat. So after coming into this matrix concept, the entire scenario for me changed. We were all told in our undergraduation that or post graduation that contraction is an active process, and relaxation is a passive process. But once I understood the matrix concept, here you need to see the working of this live cell. The video is not being played. Okay, no problem. So this is the normal cell that is working, or it is oscillating at a specific rhythm. In this, there is action potential which reaches the cell. So there is depolarization which happens. So in this depolarized state, there is liberation of energy. So the cell contracts. When the cell contracts, there is energy that is thrown out, and that is how we utilize this energy in our activities of daily living. But from the contracted state, the cell should come back to its original state, and for that also we require energy. If if there is no energy available, then the cell remains in the contracted state. This is the pathological state what we are talking about. There is the energy deficiency of a cell from a contracted state, where it doesn't come back to its original state. There is no repolarization that has occurred. So when the cells remain in the contracted state, there is a structural change. When there is structural change, then we see it in the form of disease. Disease do not occur overnight. Disease has a time frame. In this time frame, we have to correct the cellular biology. Once we correct, the entire derailed processes will come back to its normal process. So this entire slide is most important. I will repeat it once again. The contracted, the cells keep oscillating at the regular frequency of 8 to 12 hertz. There is action potential which comes, and from and there is depolarization which occurs. The depolarization causes energy liberation. The energy liberated is utilized, but the cells go in contracted state. So from contracted state to come, the cells to come back to the normal state, it requires energy. And this, if there is energy which is present, then definitely there will be, the cells will come back to their normal state. But if the energy is absent, there is no available energy, the cells remain in the contracted state. Once the cells are in contracted state for over a period of time, there is structural change that is occurring. The structural change will lead to disease process. Yes, after this slide, we need to now understand what is extracellular matrix. Okay, the extracellular matrix is nothing but it is surrounded, or it surrounds the 70 trillion cells of human body like fishes in the water. So if we consider an aquarium, the water in the aquarium should be healthy for the fishes to be healthy. So if the water is contaminated, the fishes won't be healthy. So applying this simple concept, we consider if the extracellular matrix is more acidic in nature, it does not provide a healthier environment to our body cells. So the bad logistic on the cellular levels causes successively symptoms macroscopically. So whatever changes we are seeing as a symptom is nothing but the changes which have occurred at the much microscopic level. So in this second image, we can see a bigger fish which comes into picture, which disrupts the entire fishes in the ocean. So this is nothing but the disease which comes, and this disease should be treated, and that is how we understand that the disease process is present. So next one is the how to maintain a healthier extracellular matrix. It is maintained by the lymphatic channels. The least studied in our curriculum is the lymphatic channels. The next question to all the attendees is, what is the lymphatic channel of the brain called? What is the lymphatic channel of the brain called? It has its own lymphatic drainage system. It's not associated with the other parts of the body. It has its own. So what is it called? So as we all know, lymph is nothing but a clear interstitial fluid. So it drains out the entire metabolic waste products. So if this entire channel is blocked, if it is non-functional, then the extracellular matrix gets contaminated, and there is more acidic environment which is created, and that is harmful for the entire body. So we have to maintain a very good quality of extracellular matrix. So the 20th century saw or treated the symptom rather than the cause. So they were more interested in treating symptoms. You have pain, this is the treatment. There is stiffness, this is the treatment. But they forgot to understand there are various causes for each and every symptom. So the 21st century is directed towards the systemic medicine, which treats the fruit as well as the root. And the physiotherapists are working at this level. We assess to understand what is the problem, and then we treat uh, uh, what is causing the problem. So here, if there is no good shift, or if there is no good paradigm shift, then probably we may not be able to treat very well all our cases. So when I say symptoms, the first and foremost system, the most important systems for us is pain. So what is pain? Pain is nothing but it is the cry of the tissue for oxygen. The tissue is crying, I need oxygen for to function normally. So if there is poor circulation, if there is a healthy circulation, that improves oxygenation, which in turn improves the ATP production, and that in turn relaxes. Now, once we go back to our previous slide where I said that contraction is a passive process and relaxation is an active process, here is the answer for it. Here, if there is a healthy circulation, it delivers very good oxygen. Very good oxygen is required for the mitochondria, where we can easily produce very good amount of ATPs. Since there is very good ATPs present, there is very good relaxation which occurs in the muscle tissue, and a relaxed muscle tissue is a healthy tissue. So so most diseases for us will again be a mitochondrial diseases, where we need to supply very good oxygen to the mitochondria, where it can generate a very good number of ATPs. Next one is what is wrong, or what is the disease process in the musculoskeletal system. That is a contracted or a blocked tissue. There is blocked microcirculation which prevents any movement, and it causes pain. So we all know that tendon is the functional unit. When I say tendon, the normal tendon is the one which has a normal belly and a normal tendon. If we consider any of the tightened structures, tightness contractures, we always see that there is a big belly and a thin tendon, which can be very well appreciated in cases of cerebral palsy kids, especially the adductor muscles. When we see the adductor muscles, the muscles are having thinner tendons, but they have a bigger belly. Here, the length tension relationship is altered. Hence, the muscle is not able to contract, and if it contracts, it does not, it is not, or it does not relax very well, and that in turn leads to again a disease process. Next one is, we have spoken about the length and tension. Now in tension, a high muscle tone causes tendon and muscle ruptures. Now if you see the picture on your right hand side, the TA or the gastrosoleus muscle is more contracted when compared to the left side. So the right side is more prone for an injury, and with our assessment we understand where it is more prone? It is exactly prone where there is musculotendinous junction. This is the weakest part of a muscle, where you will usually see the maximum, where you will easily see a rupture at the muscle tissue. And next one is at the insertion level. That is because of a thin tendon. It does not hold the bone in a normal state, and thus it can cause a rupture. This is again seen on a ultrasonography, where we have located the ruptures mostly in the belly. So what are the changes that we expect with immobilization of muscle tissue? Why immobilization? All are fracture cases where we are advised we should not move the muscle actively, and we should give rest with XYZ reasons. What happens with it? The first and foremost thing is there is decreased muscle fiber size. This in turn will lead to change in muscle resting length. This will lead to reduction in size and number of mitochondria. This will lead to reduction in total muscle weight. This increases the muscle contraction time. So when there is increased muscle contraction time, there will be increase in muscle relaxation time as well. So the muscle does not relax. So there will be decreased muscle tension that will be produced. That is, the force of muscle contraction will be lesser. So there will be lesser ATPs that will be formed. This lesser ATPs will be underutilized during exercises. This increases the lactate concentration. This again decreases the protein synthesis. So we are not building up the muscle if we are unable to maintain an adequate length in the muscle. So the first and foremost is to maintain an adequate length, which in turn will maintain a very good tension. Next coming is the disease process. In disease process, we all know the geriatric population are more prone for illnesses, mostly the musculoskeletal as well as the other systemic illnesses. But right now, our main question is, how do we maintain a healthy body in old age? This is the commonest question each and every physio is been asked. A 60-year-old walks in your center and questions, sir, how can I have a healthy lifestyle at this age? What we need to understand is we need to make his body elastic, not flexible. Now, the third question for all the attendees is, what is the difference between elasticity and flexibility? So once there is blockages in the body and in the mind, there will be tension in the muscle. Now, tension is nothing but tone. There is increased tone in the muscle. This reduces the range of motion, and this causes chronic pain that in turn will lead to the degenerative changes. So the main question now comes is, how is it possible to stay elastic and harmonic in the mind and body as long as possible? Now, to answer this question, we are into matrix rhythm therapy. Now, matrix rhythm therapy is nothing but it is a pain, or the rationale is the pain syndrome remains only when there is contracted tissue. A contracted tissue is nothing but cellular energy crisis. In the pathophysiological model, for explanation of myofascial, myoacidotic, and myotendinic pain syndromes. Now we will be breaking down all these words. Myofascial, we all know fascia, we all know muscle. So if the fascia is adherent to the muscle or the muscle is adherent to the fascia, the muscle will not function normally. One. Myoacidotic, if the muscle tissue is more acidic in nature, it will not contract well. The myotendinic, if the myotendinous junction is not healthy, it will all be leading to pain syndromes. And this pain syndrome is nothing but deficient energy metabolism at the cellular level. Now this entire concept we are dealing with or dealing at the cellular level. We are not dealing it macroscopically. We are dealing with at the microscopic level, and it should be normalized with adequate therapies. So before we start with an exercise, we have to promote a conducive environment or a healthy environment at the cellular level. And how can we do that? It is done with matrix rhythm therapy. So what is, after finding all these changes in human body, that is, there is change or there is disturbance at the cellular level. This disturbance has reduced the cell oscillations. This reduced cell oscillations has reduced the extracellular matrix, or it has reduced the extracellular space. This reduced extracellular space has reduced the intra-extracellular transportations. The exchange of nutrients is reduced. Then because of this, there is reduced oxygen at the cellular level, leading to hypoxia of a cell. This reduced hypoxia has caused reduced ATP formation. This reduced ATP formation has caused reduced ATPs available for repolarization. This has increased the contraction time. This has reduced the mobility. This has shortened the tissue, and thus there is restricted range of motion. With restricted range of motion, there is again altered neural feedback to the brain. This altered neural feedback to the brain again leads to a postural change. This postural change leads to deformity. And this is the time when the case comes into your clinic, and we have to understand that whether we need to treat the deformity or whether we need to treat the posture, or whether we need to treat the stiffness. So once we have understood these processes derailments, matrix rhythm therapy is a simple device in which there is a resonator. This resonator is placed on the muscle to be treated, and the physiological processes are normalized. Now, matrix rhythm therapy is nothing but normalizing the physiological processes by phase synchronous magnetomechanical oscillations in a freely adjustable range of 8 to 12 Hertz. Now, again, I will be breaking down these words. Phase synchronous. It means that it is phasic. It has crests and troughs. It is synchronous. It has its own spatial as well as temporal parameters. It is magnetic. The head or the resonator is magnetic, and it delivers a mechanical oscillations which are in the range of 8 to 12 Hertz. Now, by delivering this treatment, what we are trying to do, we are trying to normalize the cellular rhythm as well as the flux density in the extracellular space. Now we are trying to create a healthy environment around the cell so that the body can heal from within. So how can we do that? Since there is a derailed biochemical and biophysical processes, we have to reactivate and readapt to all these changes. And the most important aspect or effect of matrix rhythm therapy is entrainment effect. Now, what is this entrainment effect? Entrainment effect is nothing but it is the biological important body specific rhythm. It is biological important body specific rhythm of a healthy tissue which is coherent, magnetic, and it is oscillating, that are reintroduced in the body from an external source, in order to reactivate or rather regenerate or to readapt. Now we have to either reactivate it, or we have to regenerate it, or we have to readapt. to the biochemical, biophysiological processes that are coupled to the rhythmic action, which were out of synchronization. So we have to synchronize each and every cell in the human body so that we can reactivate, regenerate, and readapt. So with these physiological rhythms, which are delivered by matrix rhythm therapy, we readapt the pathophysiological processes. So we get back from the pathological state of the body, we get back to the normal physiological process. So once the body comes back to its normal physiological process, it has to work normally. It has to work within its normal physiological parameters. We tend to eliminate the process of a disease because we have provided an environment for the cell to work normally. To understand how a disease process comes into picture, there was a simple experiment done by Ulrich Randoll sir. I request you to hear the audio correctly. This is the phase synchronous, where each and every cell is coherent and it is synchronous, working normally. There is a pathological state which comes into picture now. There is disruption. There is a blockage. One cell gets disrupted. You hear the audio now.
Varun sir, there is a grievance. The panelist can't hear it. Is it possible to increase it a little louder, please? Is there a provision for this?
So they all produce one sound. This happens when they oscillate rhythmically. There is a blockage or disease process which comes into picture. One cell is derailed.
Varun sir, are you playing any video, sir?
Yes, I am playing a video.
No, sir. It is not audible. It is neither audible nor visible. Neither audible nor visible, sir.
Okay, so 1 second, I will just check. Okay, so in that video, what we saw was there was a metronome where uh, the hands of a particular instrument was oscillating. There were 5 instruments. They were all oscillating in a particular frequency, and suddenly, and they were all producing one single voice or one single voice. But there was a blockage or there was a disruption which was created to one particular hand, and that caused many voices. And this can be understood only when we see this particular video, but unfortunately we cannot. So moving on to next is Randoll's bifurcation. Now we all understand, as a physiotherapy point of view, we always tell our cases that when we are working on the range or pain, we tell them that, okay, you can recover only 50%, you can recover only 70%. This usually happens when there is tightness and when there is a contracture. So when there is contracture, we say that no, this is a surgeon's opinion or whatever it is. And we, as a physiotherapy point of view, we have a limited scope, but wherein tightness, we have a very good scope in treating such cases. So on what basis do we can we say that this
Uh, Varun sir, sorry to interrupt you. Can you just get your microphone a little closer, sir?
now,
The voice is getting a little feebler.
now is it clear, sir? Is it fine now?
Yeah.
Yes. Okay. So in Randoll's bifurcation, we have a very simple module. The first module is the survival mode, and second one is injury mode. The survival mode, the body reacts by itself, where it has its own ways for repolarization by contraction of the muscle, where it maintains the normal pH. Then there is regeneration, repolarization, the body recovers from the fatigue and everything. But the most important component for us is the injury mode. In injury mode, either it is reversible or it is irreversible. So physiotherapy and matrix rhythm therapy plays an important role in reversible conditions where there is pain and hardening of a tissue. But when there is a rupture of any particular tissue or vessels, matrix rhythm therapy may not be helpful in the initial stages and may require surgical range. So we have to understand this particular model, that is Randoll's bifurcation. The injury mode has two modes, that is reversible and irreversible. We are using matrix rhythm therapy in reversible only and not in irreversible cases. Now, for this, your assessment comes into picture. I don't know how many of you all know about the circadian rhythm. The circadian rhythm has this entire concept has won Nobel Prize in 2016. It is very recent, where the scientists have discovered that the body has its biochemical and biophysiological processes that are connected to both body internal and body external rhythms. So each and everything that is happening inside and outside our body, they are having an effect, and this effect causes some biochemical and biophysical changes at the cellular level. So if it is good, the body is healthy. If it is bad, then the body is diseased. So there should be a correct rhythm for healthy life. So we have understood that what is the correct rhythm of a cell, that is 8 to 12 hertz. Now the focus should be more on the skeletal muscle to maintain the entire physiological processes which are occurring in our body. So any wrong rhythm will correlate to pain and hardening in the musculoskeletal system. So the healthy muscle synchronizes at 8 to 12 hertz. This is what we know till date, that the muscle always has a cellular frequency of 8 to 12 hertz. So what are the specific effects of matrix rhythm therapy? It helps in activation of metabolism. There is acceleration of venous and lymphatic flow because of contraction and relaxation. Then there is activation of the immune system. There is normalization of the alpha tension of the musculatures. Then there is neuromuscular activation via the reflex arcs. Then there is targeted relaxation of local muscular spasm. Then there is targeted removal of contraction residue. These are nothing but metabolic waste products. So we are again trying to create a healthy environment. Next one is, what are the chemical effect by matrix rhythm therapy? It helps in acceleration of the thixotrophic reaction from gel to fluid. Next question is, what is thixotrophic reaction? These all questions are very much important in your clinical practice. So what is thixotrophic reaction? This is very well given in our Cynthia Norkin's biomechanics book. Then this will lead to reduction in viscosity. This will regulate the interstitial pH value. This increases the tissue temperature to normal temperature, and this promotes secretion of growth factors. So this accelerates healing process. So what are the indications? The indications are there is reduction in swelling, there is improvement in elasticity, then regulation of local hypertonia or hypotonia, then there is pain management. Now I have not given specifically the name of conditions. Matrix rhythm therapy can be very well used in many conditions, and there are so many other conditions which can be very well treated with matrix. There are again restricted mobility, then improvement in the functional and structural nerve regenerations, then acceleration of chronic degenerative diseases, then there is a restoration of functionals at the tissue level. These are the basic indications. So matrix rhythm therapy can be very well treated from pediatric to geriatric, from musculoskeletal to vascular, to any ulcerative conditions. So this improves the scope of our practice. Once we understand what is the scope of physiotherapeutic practice and what are the level of cases we can deal with, matrix rhythm therapy is always beneficial in treating all such cases. When matrix rhythm therapy is not beneficial, it is contraindicated in open inflamed infectious surfaces, any fresh fractures, any condition which has tendency of bleeding, in embolism, in cardiac pacemakers, direct contact to bone and direct contact to ice. In such conditions, we do not use matrix rhythm therapy. We do not use matrix as a direct contact to bone because bone has a frequency of 1 to 2 hertz. Hence, we do not deliver matrix. Then this is the basic matrix rhythm therapy. Raghavan sir, is my video available? Am I live?
Sir, you are live, sir. You are live. Go ahead, please.
Okay. Now this is the normal matrix head, or this is the resonator what we are speaking about. Now in this, the oscillations are delivered in a phasic manner. Okay, it's not a vibrator, it's a oscillator. It is oscillating at a particular frequency, which is in between 8 to 12 hertz. Okay, so once we are using this, so the head of the resonator is called as, or it is logarithmic spiral. The most important concept of logarithmic spiral is it produces resonance. It means that the oscillations are delivered from one cell to the other cell in terms of resonance. It moves, the oscillations move. It's just like when you throw a pebble in a pond, there are ripples that have been produced. Similarly, there is ripples that have been produced in our human cells, which are delivering at a particular frequency of 8 to 12 hertz. And for that, the head or the resonator of matrix rhythm therapy is important. This logarithmic spiral is present in our entire universe. It's not present, or the development is done only with it is considered in the nature itself. So logarithmic spiral is present in the entire universe. So the resonator. So why the resonator head is important? So whenever we are scooping or whenever we are treating this any particular tissue using matrix rhythm therapy, the larger the radius, the larger the hub, and this causes a better elongation. So the better elongation will improve the length of a particular tissue, and the length improves, or it creates a better space around the cells, so that the cells can oscillate at a normal frequency. The cells can open up from their contracted state. So this treatment is delivered for the cellular level, which from an external source, and the change that we see is at the microscopic level. So this is the basic what we say, the intensity at which we place. Usually we treat at 10 o'clock position, and we don't usually prescribe a specific intensity, because it all depends on the tissue resistance. So if the tissue resistance is higher, then the intensity or the frequency is set lower, and if the tissue resistance is lower, the frequency is set higher. But the frequency will always be between 8 to 12 hertz. So what are the post-treatment care we need to tell our cases, or we need to take? First one is water intake, that is 2 to 3 liters in a day. The next question to all the attendees are, why do we ask our subjects to drink 2 to 3 liters of water in a day? In general, in all our physiotherapy practice, we always tell our subjects that you need to drink a lot of water. What is the importance of drinking 2 to 3 liters of water in a day? Then next one is, we ask our cases to drink 1 liter of water within 2 hours of therapy. We ask them no carbonated drinks and sugary drinks after treatment. We ask them to avoid stress after therapy. Hot fermentation is important. We ask them to perform breathing exercises, because we want to improve the oxygenation. Then we ask the our cases to move or to do active exercises, so that it keeps the mobility of a particular joint or area that is treated. And we ask them to reduce the carbohydrate intakes and have fresh fruits and vegetables. This is the post-treatment care what we advise. So basically, for conclusion or the summary, life is a rhythmic movement. If there is no rhythmic movement, there is setting up of disease. Then diseases are nothing but disturbances until total stop. Then the basic therapy must be readaptation of rhythms on the level of cell biological regulation. Until and unless we cannot readapt to the rhythms, we cannot treat any of the conditions. Second one is, what is the frequency of this matrix rhythm therapy? It is between 8 to 12 hertz. What is the amplitude? It's an amplitude modulation. Amplitude modulation means higher resistance of the tissue, lower should be the frequency, and lower the tissue resistance, higher should be the frequency. Then next question for all the attendees is, all our electrotherapeutic modalities, we say that there is vasodilatation which is created by our physiotherapeutic modalities. So at what time duration is vasodilatation occurring? So vasodilatation occurs only at 20 minutes of treatment. If you are treating for 10 minutes, 15 minutes, it's of no use. You have to treat for minimum 20 minutes. Hence, matrix rhythm therapy is treated for 60 minutes. It's not a 10 minutes, 15 minutes, or 20 minutes of treatment. The entire cycle is for 60 minutes. And the treatment duration is 60 minutes. Yes. So we all have the potential to live in blissfulness and inner well-being, if only we create the right kind of climate within ourselves. So the first and foremost thing is, if you people are thinking that you are treaters, then stop doing that. We all are only healers. We form a conducive environment so that the body heals from within. We just need to supply that environment, then only the body heals. We cannot treat any of the conditions. Treatment, not even by other medical professionals, they only try to create a conducive environment so that the body can heal from within. The human spirit must prevail over technology. I know matrix rhythm therapy is a technology, but it's not the machine which has the magic. It's the man behind the machine which does the magic. Yes, sir.
Yes, sir. That was an excellent, informative session from you. A greater insight about matrix rhythm therapy. Can we go ahead with the question and answer session, sir?
Yes, sir.
There is a question. One person wants to know how many days or months the effect of matrix will last.
Yes, it's an excellent question, sir. Matrix rhythm therapy, we do not do every day, sir. We usually treat once in 4 days, because once we deliver matrix rhythm therapy, the tissue itself starts healing from within, because there is a micro trauma that will be caused. So the body tries to react to that. So the body tries to heal from within. So if we consider how many days or how many what is the time duration, then I would recommend matrix is taken once a week or once in 4 days till the condition improves. No, it's not that there is a specific time duration for any such any of the conditions. Now, I have treated frozen shoulders for 10 sessions, as well as I have treated a frozen shoulder with 1 session who have recovered. But only thing is, we have to treat or use matrix rhythm therapy once in 4 days or once in a week. That's it, till the condition improves.
Yes, sir. Thank you. Thank you so much. And the next question we will take from Facebook, sir. The question is, Darshi Ratna wants to know whether can we treat osteoarthritis with this matrix rhythm therapy?
Yes, sir. Now, matrix rhythm therapy also does not follow any of the diagnosis, sir. Now, osteoarthritis is a diagnosis for us, but basically we are not treating, none of us are treating osteoarthritis. We are because it's a degenerative disease. For me, osteoarthritis will be either the quadriceps muscles are weaker, the hamstring muscles are tight, and the TA muscles are tight, and there is structural deformation in the joint. So once I see the case, I would like to work upon hamstring muscles to improve the length of hamstrings, improve the length of TA, as well as strengthen the quadriceps muscle. So very well, we have treated osteoarthritis, and the patients have recovered well using matrix rhythm therapy.
Okay. Thank you. Thank you, sir.
Yes, sir.
Can this be used on cancer patients, sir? The next question.
Yes. So the researches are under process of using matrix rhythm therapy, but as of now, we are not using matrix rhythm therapy in active cases. However, we have used in breast cancer cases where surgical removal of cancer was done, and the complications of surgery was very well treated, like the lymphedema of upper limb. And I do have some of the images. Later on, I can share it, sir. But in active cases, we do not use matrix rhythm therapy because there are no evidences supporting that.
Okay. Thank you. Can this be used on pregnant women? Is the next question, sir.
Yes, it can be very well used on pregnant women. The resonator head that I had shown you, there are 2 types, sir, in that. The first one is magnetic and second one is non-magnetic. We can very well use the non-magnetic head in treating all the illnesses the pregnant woman may complain about. Yes, we can use it.
Oh, great. Is it useful in any respiratory condition, sir? Is the next question from Facebook.
Yes.
Devika
Yes.
Nandu wants to know.
Yes.
Is it
So,
useful in respiratory conditions?
yes. So right now we are in the research process of considering COPDs. But right now, when I had been to Germany, we had very well seen from Randoll sir's cases. He used to work on all these asthma cases and COPD cases, where he would work on the rib cages, on the intercostal muscles, on the diaphragm, so that the chest would open up, and that in turn would lead to improved what we say the ventilation. And yes, definitely matrix has a role in respiratory conditions.
Okay, great. And then one more question from Facebook. This is a Facebook question, sir. Deepu
Yes,
Thakur wants to know, can we treat trigger points with this?
sir, it's an excellent device to treat trigger points. Excellent. Trigger points are nothing but contracted state of a muscle. There is no oxygen which is present. So by delivering matrix rhythm therapy at that specific trigger points, we tend to open up the cells. We tend to improve the circulation, as well as we tend to bring more oxygen at that site, and we have seen immediate relief in such cases.
Okay. Okay. Thank you, sir. And one last question: what frequency to be used for pediatric patients? Is the same, or is there a difference in pediatric and?
Same. It is same, sir. Because the pediatric cases also oscillate. The cells oscillate at a same frequency. There is no change. So we use at a same frequency.
Okay.
There is no change.
Yes, sir. Thank you. And one more question is: can this therapy be used in CABG cases?
Now, let me understand what is CABG. Now, CABG is a surgical intervention which is already done. So, if the question is directed towards if there is any complications associated with CABG like CABG, like the stiffness of the shoulder or frozen shoulder, then yes, it's not contraindicated in CABG cases. We can very well use matrix rhythm therapy in treating the complications of CABG, but we are not treating CABG.
Okay. Okay. Thank you, sir. So one question from Sahil. Sahil wants to know: is it contraindicated in epilepsy children?
Sir, it is not contraindicated in epilepsy children, but I don't know, means when we say epilepsy children, which part or what component the attendee wants to address, what he wants to treat in epilepsy children. We are not normalizing the electrophysiological changes which is happening in the brain. We are not doing that, sir. But definitely the changes which have occurred at the musculoskeletal system, we can very well treat with matrix rhythm therapy.
Okay, sir. Okay. Thank you. Thank you so much. Over to you, Sai Mahendra, sir.
Thank you, sir. There's one more question here, which I would like to take, which is sent by Dr. Ayyappan. He is asking, how is it different from MFR and dry needling, sir?
So it is similar to MFR, but we are working at the cellular level. Now, when I say cellular level, we are mobilizing the cells. But in MFR, we are trying to release the fascia. Now, releasing the fascia, we are just trying to remove the adhesions which is present between the muscle and the fascia. But in matrix rhythm therapy, we are working at the cellular level. We are trying to create a conducive environment so that whatever restrictions is imposed on the muscle or on the fascia is eliminated. Second one is the effect of matrix rhythm therapy remains for weeks together, but with MFR, I think we have to repeatedly keep doing it every day till we achieve the success. And dry needling has its own principles, sir. We cannot compare matrix rhythm therapy and dry needling. Dry needling, we are actually puncturing or we are damaging the entire tissue, and we are trying to regenerate a new tissue. But matrix rhythm therapy is much more safer when compared with dry needling.
Okay, thank you, sir. And I request any participant wants to talk to the speaker, they can raise their hand, raise their hand icon.
Okay, I think there's one more question. A physio wants to ask, what would be the charges for 60 minutes of therapy, one session for matrix therapy?
So the charges depends on your expertise and your level of practice. We have therapists who are charging 1,000 rupees per session to 6,000 rupees per session. So there is a huge transition of the charges, but it depends on individual aspect rather than coming down to a specific price quote. But only thing is, since our physio is actually investing 60 minutes with the treatment, and he himself has to deliver it, it's not a equipment where it does it on its own. I think charging reasonable is good enough.
Very well said, sir. We have one more speaker, a participant who wants to speak to you. I think it's Sumita, right? Can you please
Yes, sir.
speak, madam? Yeah.
Yes, sir. Sir, I have a question about the Randoll bifurcation. You had said that it's applicable in the injury mode, and especially the reversible injuries only. So could you please throw light on why is that so, and how can we judge if the injury is reversible or irreversible, sir? Thank you, sir.
Yes, thank you, ma'am. It's a nice question. Now, when we speak about Randoll's bifurcation, there are basically two types. One is survival mode and one is injury mode. Survival mode we are going through every day, and injury mode is only when there is a disease process. So when in our initial assessment, what we try to assess is with our palpation skills is how good the tissue is, and what are the basic symptoms of a particular case, whether uh, his pain is more, or whether his restricted range is more, or whether he is having difficulty in his functional activities. These are three components what we tend to assess. Now, if there is limitation in his functional activities, then we have to understand what is causing it. So now, what is causing it? Here comes injury mode, the cause. Now, in this cause, we have to analyze whether the entire tissue is is changed to a irreversible state. Now, for example, uh, if we say cancer, the tumor, there is metastasis of tumor, then it's an irreversible state. We cannot do anything in this. But when we speak about muscle, that time the muscle will respond only with either it is contracted or it is in a lengthened position. See, if a muscle is lengthened, it is abnormal. If it is contracted, it is abnormal. It has to maintain its adequate length. So in this entire scenario, we have to know that whether it is the pain or whether it is hardening, which is in the reversible state. Whatever treatment you give, whether you can reverse this entire treatment. If it is tightness, you can reverse it. If it is a contracture, you cannot reverse it. So Randoll's bifurcation tells us this entire aspect, whether the assessed case can be treated with matrix rhythm therapy or whether it cannot be treated with matrix rhythm therapy. So in that, your assessment comes into picture. This assessment is done through your manual palpation, through your active range of motion, through your passive range of motion. If the entire joint is fused, if there is fibrosis of the joint, then you cannot work much. But if there is tightness of the tissue, you can very well work. So the the fibrosis of the joint is an irreversible for us. So we are not working on that. But there is tightness in the muscle, it is a reversible. So we have very well understood that in the injury mode, we are having either reversible or irreversible. Reversible, your assessment will tell us. So only tissue which can respond to matrix rhythm therapy can be very well treated. Tissues which cannot be responded should not be treated.
Thank you, sir. Well, I'm tempted to ask one more question. What is the cost of this machine, sir?
So when I had bought, it was 4,10,000.
Oh, okay. Now, what is it? What do you feel that it has been? No, I'm asking you what could be the price of it as of now? Because when you bought, is it quite some time back?
So I bought it in 2015.
Okay, it's 5 years now. Any idea
5
what's the
years.
present price? Yeah.
So I think there may be a hike of 20-30%.
20-30%. Okay,
Yes.
about 5 lakh change now.
Yes, sir. Probably.
Thank you.
Yes.
Sir, I think we'll wind up. It's been quite some time now. It's 9 o'clock, 9:15. So we will just wind up, sir.
Yes.
So, Rangnath, sir?
Yeah, yes, sir.
Yeah, can we wind up, sir?
Yeah, please go ahead.
Yeah.
And I would thank once again for the speaker today. A big informative session we had. The session was great with all the required information where people knew limited about it. He made sure that this matrix rhythm therapy reaches even from the student level to the practitioners, probably a new insight about the technology and about the new treatment regimen, which we can take this as a take-home message. Thank you so much, sir. Over to you, Sai Mahendra, sir.
Yeah, thank you, Raghunath, sir, for being such a wonderful moderator and taking the session very nicely. You've been of great help to us. Thank you so much. Thank you, Dr. Varun Naik. Very informative session, and I'm sure this session needs more time. There's so
Yes,
much
sir.
questions coming in
Yes, sir.
and so much information to be given out. So we will definitely,
Yes.
once
Yes.
the lockdown is open and we're all free to move around, we'll have a workshop
Yes, sir.
by you, wherein you can give in more inputs and probably some practical demonstration as to
Yes,
how
sir.
you can
Yes.
go about treating
Apply.
patients. So I'm sure
Yes.
the physios here would benefit out of it, and we will
Yes.
take it forward. And I would like to thank Dr. Madhusudan sir here also for taking his time out and being a part of this webinar. Thank you, sir. And this is the start of the webinar series again, which we had stopped for some time due to some holidays and things, and there were some network issues as well. So we will continue the webinar sessions, and I want all the participants to please log in and into your Zoom and Facebook or YouTube links and take benefit out of it. Thank you very much. Good night and take care.
Thank you, sir. Thank you. Thank you, KSPF.
Thank you.
Thank you.